Sir.
Yes. Good morning all attendees and panelist team. आज के हमारे वेबिनार सीरीज नंबर 7 में डॉक्टर अली ईरानी सर प्रस्तुत हुए हैं। न्यू इंडियन एजुकेशन रिसर्च सोसाइटी संचालित ओधवराम फिजियोथेरेपी कॉलेज के प्रतिनिधि के तौर पर मैं उनका हार्दिक स्वागत करता हूं। साहब के बारे में मेरे वर्ड्स बहुत कम पड़ जाएंगे। सर जो महान हस्ती और भारतीय क्रिकेट टीम के भूतपूर्व फिजियोथेरापिस्ट, उनका जो कद है उसके बारे में मेरे शब्द छोटे पड़ेंगे। हमारा सौभाग्य है कि आज इतनी व्यस्तता के बीच वो हमारे सामने आज प्रस्तुत हो सके। I am inviting Dr. Mehul Contractor give a few words for Dr. Irani sir. और आज एक बात और मैं ऐड करना चाहूंगा। आज 28 मई है, सो इंटरनेशनल वुमेन्स हेल्थ डे है। तो मैं सभी बहनों, पुत्रियों और माताओं के स्वास्थ्य के लिए मैं शुभकामनाओं और मंगल कामनाओं और उनको हार्दिक शुभेच्छाओं देता हूँ। सर प्लीज स्टार्ट योर टॉक।
Yes. Good morning to all the viewers. Well, as Prakash sir mentioned, today's speaker for our webinar, Dr. Irani sir, the name itself is enough. Everyone knows his introduction. Hardly in the profession of physiotherapy that, the almost, I would say, the out of 100% population, maybe out of 100 population, they might be knowing the Dr. Irani sir. He is a legend in our profession. People knows him everywhere, like whether it is lecture or whether it is patient treatment or whether it is webinar or conferences, then workshops is. So there are so many places the sir has marked their presence and then given the knowledge to all the students and enlightened them their life. So I would like to request Dr. Niyati Patel that introduce Ali Rani sir, and then we'll move on.
Okay, sir. Hello, everyone. Good morning to all. Myself, Dr. Niyati Patel. I am an assistant professor of Shree Odhavram Physiotherapy College. It's my pleasure to start this webinar. So, by heartily welcome to Honorable Chief Speaker Dr. Ali Irani sir, Principal Dr. Mehul sir, as well as our CEO Prakash sir, my colleagues, the staffs, as well as my beloved students. So now I would like to introduce Ali Irani sir. Sir is a HOD of Sports Medicine and Rehabilitation Center at Nanavati Super Specialty Hospital, and he was President of Indian Association of Physiotherapy. Sir has completed them BPT from MS University at Baroda, and they had completed them PhD in Sports Medicine as well as Anatomy of Body Movements and Dance at Bombay University. And sir's having a very good experience as a physiotherapy for the Indian cricket team, as well as sir's having academic experience as a PhD guideship and PG guideship in the various colleges. Sir has conducted so many workshops and delivered so many expert talks in the many conferences as well as colleges. So I am not wasting of that much of time for the introduce that well unknown personality. So I would like to Dr. Ali Irani sir for the carry forward the lecture. Thank you, sir.
Good morning. Good morning, VN College. Thank you, Dr. Mehul, contractor. Thank you for calling me and your kind words. I remember I had come to your college a few months back, and it was late evening Sunday, and I had to rush back to Mumbai because I had other meetings in row. Thanks a lot. But as promised earlier, whenever called after Corona gets over, if things open up, hopefully I'll come one day and spend morning to evening teaching your students whatever I know. So very good morning to all of you. And dear students, my topic today was to do with spine, that is cervical, thoracic and lumbar, how to mobilize it. We won't talk about manipulating it because you have to first learn to mobilize and then gradually we will move to manipulation. So before that, because we are in an era of corona, and lot of questions have come to me before coming on my Instagram, on my Facebook, regarding to understand and talk about corona. So a brief thing. Corona is like any other thing, like cough, cold, and pneumonia that we get. Nothing to worry. One. Two, there are very, very simple tests that you can know, which you have to do it on yourself and your parents at home or your brothers and sisters, neighbors. I would do it very short. Take a deep breath. Hold it. Hold it to the count of 15. Count 15 within yourself. 1, 2, 3, 4. You don't have to count, but hold it for 15 seconds and breathe out. So when you breathe out, if you don't cough, if you don't feel breathless, you're doing well. Great. So corona has come to stay. So it is as simple as when there is a window and you fear somebody coming inside through your window, you grill the window. You put iron grill so nobody comes in. You put a grill outside your door also so nobody comes in. So we have to grill our body with immunity. So what are the basic things required for immunity in our body? One, you have to have vitamin C and vitamin D. So from where vitamin C will come? Vitamin C can come from oranges. Santra. Oranges or limbu or gawa. So I have 2 oranges a day. Then vitamin D will come from drumstick. Sengad. We put it in dal and sambar, or we can make that soup also, drumstick soup. It's called sengad. I think the sengad is like a stick. That vitamin D will come through that. Or if you can't have that, I use 1 tablet a day. It's called Calgal. It is vitamin D with magnesium. So we have to. I'm working in Nanavati last 2.5 months. Our hospital is a corona patient. It's COVID-19 hospital. Today we have got 108 positive patients in our hospital. We see them. We are treating them every day. So don't fear. So just imagine. I think I may get it. So I'll immune myself not to allowing it. And if you all have a spirometer in your department, in the college, this is 2.5 liters of air. Usually lung can take 4.5 liters to 5 liters of air. Indians have it below 2 liters. Right? All Indians. And females are worse. They're below 1.5 liter. Unless you're a marathon runner or you play some game or do breathing exercises in yoga. So how you'll test it? You have to breathe in. See, this is 2.5 liter. We have got one of 4 liter. We have got one of 4.5 liter also. So a spirometer is there. Test it. Increase your breathing capacity. Increase your vital capacity. So what is a simple test of it? You will take a deep breath inside and you will bring out slowly with a hissing sound. With a hissing sound. So you can do it with me. Take a deep breath in and it will come out very slowly. See, learn from me. Listen how I come out with it. And you will see what vital capacity should be. Take a deep breath. Okay, so that's 4 liters. So do it morning, evening, whenever you see fresh air. So increase your vital capacity, that will increase the immunity. Because what you do, why we breathe? The blood rotates all over our body, comes to the base of the lung. It's impure. It travels everywhere, gives nutrition, food to everything, comes down there. So when you take a deep breath, the air hits the base of the lungs. The impure blood takes oxygen from that air. Only 20% oxygen is there if you get a good air. So it takes the oxygen, becomes pure, goes to the heart pumps it all over the body. So that's why we do breathing, if you want to know why we breathe. So do a lot of deep breathing. It will increase the vital capacity, and that increase of vital capacity will give more oxygen to the blood. And when the blood will rotate all over the body, you will have a healthy life. Everything will work much better. 2, coming to increase the capacity. 2, we all wear mask, right? So the question arises, which mask? So how to test a mask? So usually 3-ply is used. So use a 3-ply mask. If it is there, I will always put a lighter on or a matchstick, it goes off. So this mask is not good. So what I do, I take a tissue paper. That's the fold. I put it on the inside of my mask, the inside part. And I go there again, right? And see, I can't blow it off. So this mask becomes the right mask. So change the tissue paper once a day. Otherwise, even a cloth mask, put a tissue inside, so that saves you. So we don't have to buy any costly mask. I make mask from socks also. This is socks. So I put a tissue inside, and give a cut. See, my cut is for the ears. See this? I can't blow it off. So even a socks can be made into a mask. So our question gets over. No costly mask. Deep breathing important. Vitamin D3, vitamin vitamin C, vitamin D3 very, very important for high immunity. You can have adrak wali chai, and please don't forget to have haldi doodh at night. Turmeric and milk. Haldi doodh at night, your mother should give you before you sleep. It's a good immunity booster. Then there's a screen test which is always done for body temperature, which has to remain less than 100. So if it is less than 100, so when we want to see our patients, so we see the temperature of the patient, ask them to do a deep breath, and while doing a deep breath, we see whether count 15, and we see in 15 seconds they don't get breathless or they don't cough. So we are ready, we wear our gloves, we do a mask, and if the patient is doubtful, we use a shield, right? So you can use a shield also to see a patient. Otherwise, gloves, mask, enough. I use a very, very simple mask. It's a 3-ply, easy to use. There I go, and I use my gloves. And I change my gloves every patient. So please don't fear to treat patient now. We are the warriors. We have to fight, right? And keep yourself immune. Nothing to worry, right? Coming next to remaining healthy. Last 2 months you have been at home. So today's topic had to do with spine. Why I selected spine? Because 80 out of 100 people, 8 out of 10 people complain of neck problem in Mumbai, especially. See, when you take your neck forward, it is not painful. But when you take it back, see this? It's called chin tuck. So when you're taking it back is not mobile, it's stiff. So that should be practiced, right? So in demonstration, I will say sometimes we have to do it passively. This is active. So I'll show you how to do it passively also. For as a student, I want you all to know spine should be treated as a whole. You cannot, a person who is coming in with a neck problem, we have to treat the thoracic and the lumbar also. And if a person comes with a lumbar problem, please correct, maybe the posture problem is there. So correct the thoracic and cervical also. So I treat spine as a whole. Always, when the patient comes for the neck, I will treat the upper back, thoracic and lumbar also. A patient comes with thoracic problem as a whole. So when we are talking about spine, what happens? Let's talk about the spine. At night, we cuddle and sleep. We sleep on your right side or we sleep on the left side. We cuddle and sleep. So that's the position of the thoracic. Not spine is not straight. It takes a curve flexion. So that's why most of the people have a bad back, bad posture. Night we sleep, cuddle and sleep. Morning we get up, we brush our teeth, we bend forward. Then we are making a tea, bending forward. Or we are working on our desk, bending forward, or we ride our bike or drive, we are bending forward. We work whole day, we are bending forward. While eating, we are bending forward. So the spine keeps doing flexion the whole day. Extension exercises, because in spine, I will be showing you on a model. So I'll just take you out in our exercise room and we will show you the model of spine. Fine. Let's hold it here. That's the spine. So what I want you all to understand from spine. Fine. We have 7 cervical vertebrae, then we have got 12 thoracic, and there we have the 5 lumbar vertebrae. And between 2 vertebrae, always there is a disc. Between 2 vertebrae, there is a disc. Right? So if I show you the back side, right, the vertebrae, spinous process, transverse process, right? And between 2 vertebrae, the nerve comes out. See, the nerve comes out between 2 vertebrae. Okay. So between L5 S1 is a sciatica, which comes behind, right? It goes behind the leg. And cervical, the upper 3 comes to the forehead, and the below 3 comes from the backside shoulder and comes to the arms. So whenever there is a pressure on this nerve coming out of the facet, wherever that nerve supplies, you feel the pain. Right? So usually there has to be a alignment of cervical, thoracic, and lumbar. So usually what happens whole day, our thoracic goes in flexion. Right? So we need to unwind it. So the best exercise is lie on your stomach. Be on your stomach. Put a pillow under your chest. So your spine gets aligned. I'll show you. So take a pillow, a round pillow, under your chest. See, I can fine. I can be playing with my mobile, be on my laptop. I can read something. I can watch a television, or I can leave my hand like this. Right? So this exercise, I'll show you from sideways. Fine. So this exercise, all of us should do it at least half an hour in the morning and half an hour at night before we sleep. So what happens in this exercise? We unwind. So what happens in this exercise? We unwind. Okay. We need to unwind ourselves, because if you do it in the morning, rest of the day your spine will keep going, bending forward into flexion deformity. So we need to unwind half an hour, play with your mobile, read some news, watch television. You can have even tea, coffee like that. And again, you will do it before you go to sleep. Evening, if you're watching television or you're talking on phone, answering your emails, or you are on some webinar, you can take this position to even listen to webinars. Idea is extension. We don't do extension, and we don't do enough extension in whole day. So we have to start learning to do extension. Then the other way, because we are at home and we are not exercising, the other important exercise will be just sitting on the physio ball. Right? Just sitting on it. Sitting. See what happens when we sit on a chair or a sofa. We're just sitting. There's no muscle working. Right? But when you sit on a physio ball, the gluteal muscle is working, the paraspinal muscle is working, the abdominal muscles are working to keep the balance. Right? So even if you sit, so start using sitting on a physio ball, you are exercising. So if especially the kids, If your kids are sitting too much on the laptop or computer, right, for some time start teaching them they can play on the computer, only sitting on the physio ball, because the muscles are working, the core muscles are working. And we need to be concentrating, our focus is on balance, otherwise we will fall. So only balancing itself is a lot of exercises of our core muscles. So very important to use of physio ball. Right, see, any size. You can decide the size later on, very important. So there has to be this exercise done, extension to be done on a pillow, I said. If you don't have a pillow, I'm sure you will be having such pillows, right? Right? So you can see. So you can have a pillow like this, right? Under the chest, or you can bend it, fold it, and there it is. Right? Under your, so you can have tea, coffee, you can type, you can play with your mobile, you can talk on the mobile, you can watch television or read something. Okay. The spine, what is important is the hamstring muscle, right? So what happens because of any back problem, you will go through a hamstring tightness. So if any of you are standing there and just try to touch the toes, touch. Anybody who is standing there, you touch the toes, you cannot. Right? Give a towel. Right. So now, how simple it is. So fine. The question is something: if the patient has pain, you have to reduce. You have to try lying down without the pillows. Gradually, a small pillow, any other. You have to gradually. The extension has to come. The other way to do extension, if you cannot put a pillow under your chest because of the chest pain and all that, can I have a square pillow? You do it the other way around. Lie in supine, give me both the pillows. And you come here. I'll show you the other technique. Because the question came, Dr. Mehul, a question came to extension. So, focus. See the pillow here? I will keep a pillow there and I will lie supine. But the pillow will be under my thoracic. So I've actually done extension of thoracic. If I can do that, you can increase the pillow, have two pillows. Two pillows and lie in supine. So this. So what I've done extension. Physiotherapy has answer to everything. So I've done extension only by changing my lying. Supine not possible. Lie in flexion in prone not possible. Lie in supine. Put the pillow under the thoracic. So there will be an extension of thoracic. I hope all of you all know about this. What I'm holding. It is marbles, right? So see this. We used to play with marbles, but your generation, you all don't know what marbles are. So I decided, because I used to play with marbles, now I will use it as a technique for treating the and hamstring tightness. So we just showed her, we showed her she could not go down fully. She could not touch her toes. So I'm going to just put two marbles under her valgus area, under her foot. No, going fine. Right? Fine. And see the 2 minutes. And that's going to be only for 2 minutes. So she is standing here. And I want to show you the place where I put the marble. It's right there. There. So there's a fascia there. Right? So that fascia first, I used to stimulate the fascia with the back of a pen or something for 2 minutes. Right? So it usually takes 10 to 15 minutes to stretch a hamstring. When I was with the team, it would take me 10 to 15 minutes to stretch an hamstring muscle of a player. So as time went on, we derived that there's a fascia under the foot. So rather than you needing it for 2 minutes each leg, so 4 minutes. So we thought of marble. We stand on the marble and we will see the increase in the range of hamstring. The hamstring muscle gets released. Getting me? So we will see exactly after 2 minutes what it shows and whether her range has increased or not. All of you all can try it on yourself or your patient that comes for back problem. You have to go and buy a marble, use the marble keeping under the foot. I showed you all the area where I put is there. You stand on the marble there for, I hope I'm showing the right spot, right? So for 2 minutes, fine. And if she stands for 2 minutes, there she is, see the marble there? Yeah, we are removing the marble now. Fine. So she's going to touch her toes again. See? Wow. So almost she has reached. Right? Okay, come back. Found? So that's magic. Right? So just putting marble under your foot because of the fascia. You stimulated that fascia. Put this out for the wash. So it's as simple. Now, once the hamstring is released, you feel much better in the back problem. Get a stool. I will show the. I'm going to show you the chin tuck for the neck because 8 out of 10 people have neck problem. 8 out of 10 people have neck problem. Right. So I'll first show you the neck, how to mobilize the neck. So earlier neck mobilization was doing clockwise, anti-clockwise 5 times or 10 times. No, that is all wrong now. Now, only thing a patient needs to do is a chin tuck. Right? See? Chin tuck. So your neck goes, take your chin back. You have resisted. So when you do it, so how will be the test done? We will ask. You will ask the patient to look at the right side. See, patient looks to the right and you ask the patient till where they can see. Okay. And then to the left till where they can see. So the patient can know where they could see. Now we will treat. So if the patient can see more, so that we are mobilized. So always remember in spine, increase in is decrease in pain. So we just increase the range of the movement of the patient's cervical, thoracic or lumbar and automatically the pain reduces. So I'm just going to show this technique to you all, which I do it on the patient. It's called chin tuck, resisted chin tuck. So, fine. Look here. We will be just holding our thumb there. Mehul, whenever you can't see, let me know if it is not, because it's I won't know how good you all are seeing. So whenever you find out okay, you cannot, it's not says, so please come on the line and let me know. Press it more, right? So there it is.
Visible and audible, sir.
It's fine?
Yes, sir. Absolutely fine, sir.
Great. So patient is sitting on a stool or chair and we are going to under the skull, right, Atlant occipital joint. You are just holding it there, your thumb goes there and the patient is asked to do the chin tuck. So the patient pushes the neck back, push the neck, chin tuck, and you are just holding it. Count, relax. Again, do it second, push it. 1, 2, 3, 4, 5, relax. Again, she pushes 1, 2, 3, 4, 5, relax. Again, she pushes 1, 2, 3, 4, 5, relax. Now I'm going to come down on the spinous process. I'll go to the C2, C3, and each time she's going to push it back, count 5 and relax. So in many patients, it will be painful, but you have to mobilize it. So again, you push it on spinous process, relax. So the both thumbs on the spinous process, the patient pushes the head backward, push, and 1, 2, 3, 4, 5, relax. Then you go to the next one, C5, C6, and then we go to C7. So on each spinous process, you will do, right? You will do 3 to 4 times of chin tuck, 3 to 4 times to the count of 5, right? Then we come to the transverse process. So transverse process will be a little away from the spinous process. So you will go on both the sides, at least 3 centimeters on each side. So your thumb is on the transverse process, right? And she relax, go to the next one down. She pushes it back, relax, again push back, relax. So we mobilize the transverse process also, right? Okay, so that's hardly took 1 minute for us. Now we ask her to look again. We ask her to look to the right. See, the range has increased, right? She looks to the left, her range has increased, right? So once the range has increased, means the pain has decreased. I have not used diathermy, I have not used ultrasound, I have not used SSF, but the increase of range is decrease of pain. Very simple in spine. Increase the range, your pain will decrease, right? So now I'm going to ask our senior staff, Khadija and Sayeda, they are there, they're expert in spine. So they will show you all the mobilization, and through Dr. Mehul, we can ask if any question comes. They show the circle
Yes.
again. Now this is in sitting position. Passive chin tuck. The patient cannot do. Patient cannot do. So how you will do it passively? Okay. So we will show it in supine passively. Also how you can do traction on the bed, right? Of the patient. You don't need all cervical traction, another thing. So we do it manually. And we do it for thoracic also, how to open up the thoracic, how to open up the lumbar. And after that, in next 10-15 minutes, when they have shown you cervical, thoracic and lumbar, I'm going to come back and answer all your questions. So over to Khadija, she's going to show you passive. So when I have a stiff neck, I ask Khadija always to, I ask Khadija to open up my neck. Right? Most of us have a neck problems, right? So we will put them, we are going to show you passive, show you how to open up the thoracic and lumbar. And in 10 minutes, I'll come back to you. Right? Once.
Okay. Techniques. If I'm not audible or visible, just please let us know. Okay.
Yeah, sure.
What do? Is the head of the patient is in the supine position. Head of the patient is outside.
Can you bring the phone nearer to you?
The head of the patient is left loose on my leg. Okay. Now, in case the patient is complaining of a radicular pain, especially patient is complaining, I have pain radiating into my right arm. I intend to give a passive chin-tuck along with trying to open the facet. So what do? Is I gently take the neck into opposite side flexion. Okay, and I can do a passive chin-tuck. So patient is not doing anything. The entire weight of the head is supported on my leg, and one hand goes behind on the occiput, the other hand is on the mandible, and I gently just give a downward glide. How an active chin-tuck would have happened? This is a passive chin-tuck. So in the
I think your video, excuse me, your video is not visible. You need to change the settings.
Is it clear now?
The video we cannot see. Now it is clear.
Yeah.
Yes, it is clear.
Okay. So what have I done? I have gone into a left lateral flexion. My hand, one hand is on the occipital region, the other hand is on the mandible, and I have gently glided it down. Can you see this fine movement? What is happening?
Yes, we all can see.
Okay. So this is called as a passive chin-tuck, wherein I am giving a glide as well, and I am trying to open the facet on the right side. If the patient complains of pain in extension, I gently take the head into extension as well. So I have maintained my lateral flexion, I have gone into extension, and now I am giving a passive chin-tuck. If the patient complains of pain in flexion, I will still maintain this. I will go into flexion, and then I give a passive chin-tuck. Okay. If there is no radicular symptoms, but there's a facetal lock, or if I intend to give a passive chin tuck where the patient can't perform it actively, I just bring to the neutral position. Hand same on the occiput, other hand on the mandible, and this is what we call a passive chin tuck. You can again change your angles and your directions as per your restriction if extension is restricted. We go into the available range of extension and we give a passive chin tuck. As your range improves, you can increase the ranges as well. In new angles, you can try chin tucks. Okay, so it's a very fine gliding between the spine, something what the patient does not do and you do it. Okay. After this, go back on the bed. I will
There
show
is
you
just
a
one request. There is
Yes.
just one request. Initially, the video was not visible. So can you show the starting position? The
Okay,
students are asking for the starting position. Then the gliding, okay. Everyone could see that, but the starting position that they wanted to see how to start.
Okay, so we got the patient outside. The head is absolutely supported on my hand. The weight of the head is falling on my hand. The patient does not need to hold the head. Once the patient starts holding, the muscles and the ligaments start getting tense, and that's how the glide cannot be done properly. So make sure your patient is completely relaxed when you are giving a passive chin tuck. Okay, you do not need to hold the head with your hand. So what we do is you can support the leg on the head on the leg. So can you see this? It's completely supported. My both the hands are free now. So I can place one hand under the neck. The other hand comes on the mandible and we glide it. Okay. And again, if radicular symptoms are there, radicular symptoms if nerve impingement is there, we can accordingly change the angle so that we open the facet of that side and then we give a similar glide. Same thing, you can go down in extension. Okay. Now go back. I'm showing you two traction techniques wherein you don't need to use the traction machine. Okay. If you feel traction helps the patient, how do you get an active passive traction to the patient? Okay, so what you do is go down. This is what is a mulligan belt. This is the most helpful in giving segmental traction. Okay, especially if you know what level the impingement is at, you can directly go on that level and give a traction. The advantage is that you can directly go on the level because in a mechanical traction, it is a very global traction what you do. You cannot hit the segment directly. So if you know through radiographic investigations or through your clinical examination that one particular level is affected, you can take the mulligan belt, you adjust it according to your size. So this is what is good for me. Okay. I place my hands in such a way that between my two fingers is going to come my spinous process. So if you see my index finger and middle finger, between these two fingers is going to come my spinous process, and my two thumbs are going to be on the mandible, on the jaw of the patient. Okay. So, okay. Can you see this now? Between my index and the middle finger of both the hand, there was a little space. My spinous process is between that. And my thumb is over the mandible. Okay, the patient is completely relaxed. All what I'm trying to do is I'm going to push my body weight backward. Okay, there is no force from the hands coming. It is only pushing my body weight backward. The minute I push my body weight backward, I'm exerting a traction through the belt on the spinous process. Okay, so I'm on the level where I intend to give the traction. I'm holding my position and I'm shifting back. If I want to hold my traction, I can hold it for a good 5 to 7 seconds. Even 10 seconds if the patient is able to tolerate, and we discharge. follow intermittent traction. We never give a continuous traction. Okay. So I go on that area. I just exert my body weight backwards. And I come back. Okay. If two levels are involved, I can accordingly change my hand position. I can go a little lower. I shift my body weight backwards. Hold the traction for around 5 seconds, 10 seconds. And I come back. Okay. Again, in case of radicular symptoms, if I intend to give a traction along with the lateral section, I can go on the side of lateral section. Accordingly, I change my position. I come in line with the patient and I give a backward traction. Okay. So this was in the neutral position. Always remember, if you're changing the angle of the head, you have to change your position as well, because the line of force has to be in line with the patient. Okay, so this is my position. If I shift my level one level up, down. Okay, here I am with the belt, and here I go backward. Ideally, traction or distraction should relieve the patient's symptoms. But in case your patient is complaining of more pain, it would mean traction may not be indicated. You can try something else then. But usually, post a traction, the symptoms reduce. Okay. Is the procedure clear? Okay. In case you do not have the belt, how do you do a traction? You can still continue with a quick traction and active passive traction. What you can do is you sit at the head end of the patient. You lift the patient's head. Okay, so you can see my forearm is coming down. Okay. Now I need to just pronate my forearm. Okay. If I pronate my forearm, see, this is what is happening. But in the process, can you see her head moving? So technically, there's no traction happening. So what do? Is we stabilize. Okay. Once you've stabilized it firm, now that I give the traction, there is no head movement happening, and there is a traction coming at that level. Okay, so there's just pronation happening at the forearm, and there is no head movement. Okay, so in case I want to give traction to a patient, but I do not have a Mulligan belt available with me, this is one of the easiest methods to give traction. Again, I can hold it for 5 seconds, 7 seconds, 10 seconds as per the patient's tolerance, and I release. Okay. So these are simple techniques what you can give your patients, and they give tremendous results immediately. Okay. Okay, now let's try and check our range again, and let's see the improvement after all this. Okay. So we turn to the right first, come back to neutral, and we turn again to the left. Okay, so you can see the improvement in the ranges after everything is done. Now I have given so much of chin tucks to her, but I need to show her as a homework also how to do chin tuck on her own. So a very simple technique is taking the towel, okay, towel goes and gets wrapped around the neck, and she performs the chin tuck in a similar way. So this is a homework, a home technique to be performed by the patient at home. They can hold it for 5 seconds once they are in that position, and they can perform 10 repetitions 2 times to even 3 times in a day. Okay, and same thing, if you have a radicular symptom and you intend to open the first head, you can go to lateral section and you can perform the same thing. The lateral flexion could be on either sides. Okay. So these are simple techniques with which you can increase the neck mobility. Coming on to lumbar spine. Okay. You take the patient into sideline. Okay, this is kind of giving a thrust to the patient. It's a high velocity thrust, what we call. Okay, you take the upper leg down, leave it on the bed. With the lower leg, you just adjust the patient's angle. Put it under the head. Leave this loose. And see, one hand goes on your shoulder. The other hand goes on the gluteal region, on the SI. Okay. What do is, I try to remove all the slack. Slack is you take the patient into a range after which you will feel there is no movement happening. Okay. Once you have reached that level where you feel it is locked, now I cannot go any but I just give a high velocity thrust. Okay. So this is okay. This is what you do. And if you need to give any kind of MET in this angle, what you do is with this elbow, you just resist your rotation. What she's doing is she's just pushing backwards. Relax. Relax. Again, push back. I'm just trying to resist her rotation. Same thing, we repeat on the other side also. My position again, my feet goes down. My other hand, I adjust the patient's angle, release the head, my hand comes here. Okay. I remove the slack. Okay, now I feel there's no movement going to be possible. Okay, so what do? Is I just give her a thrust. Okay. Now I give her again a backward resistance. Push back. Relax. Push back, push. Relax. One more time. So these are techniques to improve the ranges of the spine. Once you give a click, you can actually hear the click sounds also. It's to open the facet. Okay. First switch, the ranges improve. And once the ranges improve, your pain levels definitely come down. Okay. So,
No, sorry. Yes, sorry, I'm with you all back. Okay. I hope you all got understood the mobilization. We have not come up to manipulation yet. So it's very important to keep your neck mobilized, your thoracic mobilized with extension, and the side rotation mobilizes your lumbar area. We are not going to in depth of all the problems created in backache, but most of the backache and the radiating backache becomes okay with this lying down in extension exercises. We make our patient do very good results, and all the neck problem also lying down in extension with a pillow under your chest gives relief to the neck. And of course, chin tuck, the self chin tuck, what we showed with the thumb, you can take a towel, keep it there and push it back. See this? Hold it there and you can do self chin tuck. Self chin tuck for your neck problem goes. I'm open to questions, Mehul. Any questions there?
Yes, sir. Let me ask. There are a few questions, sir. Let me come up with that.
The crackling sounds by mobilizing and all that is when you mobilize. One of the reason is vitamin B12. So please, most of my patient, I see a patient, if the patient is taking an appointment, I ask them to come with the report of vitamin D3 and vitamin B12. most of them they have deficiency. Vitamin B12 should be between 400 and 800 on the scale when you are seeing the report. Even if it is 375, it is less. Usually I tell them to take injection of methyl cobalt, and vitamin D3, if it is less, it should be between 40 and 80. It's the normal range, I call it, and architol is the injection for it. But drumsticks have good vitamin D3. Sengadya. It should be in your dal. You can have drumstick soup. Drumstick soup becomes very important. You can have it even at least once a week. Put senga in your dal or sambar or soup for vitamin D3. Those who are non-veg, paya soup. Paya soup is very high in vitamin D3, and red meat, that is mutton, is high in B12.
So there was one more question.
Yeah.
That how the marble keeping under the foot has increased the length or the range of motion.
It's a
That was
fascia. That's a whole different technique. We have got muscles, we have got joints, we have got tendons, we have got fascia covering all of it. So it's a trick it's a new science. When you trigger the fascia takes the control. It's the tightness of the fascia actually. So if you release the fascia, particular muscles get okay. It's like acupuncture. I used to give acupuncture between tibia fibula joint, stomach 36, gallbladder 34, and the shoulder could go up. The range of shoulder could go up. So there are different points. There is LI4 acupuncture point there at the hump. Now, when you either acupuncture, good needling there, or give pressure there, this covers up all the area, including the left side of your face. We have corresponding nerves and points which can treat.
okay. So I
It's a
hope
fascia. We found that fascia good for hamstring. Now we are working with, you see so many. I hope you can see the ball. I use different ball for, yeah. So very soon we will be showing a lot of other exercises where we can use a tennis ball and keeping it under different fascias to get a release of so many other problems. We are working on it because we have a master's course here. I'm guide of PhD, so I put students at work to create. So I want to tell Mehul to emphasize for the students to come up with new things. When I was a student in final year, I was doing research in Bombay Hospital. I came up with a steam unit. I came with TheraBand. We didn't have TheraBand, so came with blouse therapy. We came up with so many new things, techniques. So every patient, at least class-wise, I'm not saying, or make two groups in a class and ask them they should come and create something new. Why should we still stick to diathermy and ultrasound? There is two things that has remained with us for donkey's years. We feel that I've got two diathermy machines, but I've got 8 steam units. Steam. I believe steam gives better result than diathermy. I hope my network works. I'll show you. That's our gym. Steam unit working. See the units? So I use simple steam. You have to just put water in the unit. It's Indian, pure Indian. I developed it with a cooker. I used to make steam units from a cooker. So wherever there is a vessel, in place of the vessel, I used to put a pipe. And when the water is to boil in the cooker, take the steam. Wherever the patient was lying down, I could take the pipe for 6 meters, 10 meters and treat the patient with steam. So I prefer steam. I work a lot on ice. So initial anything acute, it will be ice. After that, steam. No diathermy.
okay.
Yes.
Thank you, sir. Sir, there was one more question that if the patient comes with the complaint of lumbar, lower back, okay, and if we are treating the lumbar spine, and as you have explained and guided us that as a whole we need to treat. So if we are going to treatment for the lumbar spine, then after the treatment of lumbar spine, what could be done for thoracic and cervical?
Mobilize it. Till you don't mobilize the thoracic and cervical, because the muscle, paraspinal muscle, comes from the base of your skull, goes to the gluteal. So it's one piece of muscle. So if you are treating only muscle and the thoracic and cervical are not going to be released, the problem will remain. Otherwise, the problem becomes much faster. You get relief if you release the others also. It's interconnected.
Okay.
See, when
So
you order a dosa, the chutney and the sambar also has to come. Otherwise, you won't enjoy the dosa.
correct. All the viewers, the sir would like to say that the spine acts as a close kinematically. Okay, so one portion is getting affected, then definitely the other portion like the muscle, facet, joint, spine, this is also going to affect. Okay, so in that context, the sir is asking, you need to understand the spine in a close kinematic rather than the open kinematic. So in close kinematic, you have to deal with the spine. So if you are treating the one portion, you have to mobilize the other portion. That depends on the individual conditions. So that will be the thoroughly you have to go in depth with the workshops. In that you will be learn the different tactics. Okay, so that is what the sir is intended to tell to everyone. Now, sir, there was one more question that the other therapist has shown the glidings, okay, and during the chin tuck. So, what gradings that we are using according to the patient conditions? What are the gradings that basically we are using?
See, you have to, it depends on patient to patient. We see the age, we see the osteophytes, but it's in a very simple way, you will smooth it the patient. You can see the expression of the patient's face. Right? So we were doing it on a normal individual, it was another staff. Right? But when you are taking an elderly people, but I prefer initially only do in sitting position. So you are not going to do much. So ask the patient in sitting and ask the patient to push it backward. If you are doing it on your mother, on your father, and give them relief, believe me, you should do it on your parents. They will find relief and they will bless you. Our profession has got a lot to do with blessing. I always tell my students, okay, do something for your parents that they tell you paisa vasool. Whatever money they have spent on you, they should feel ke paisa vasool. Right? It was worth sending you for physiotherapy. So please
Yes.
do all this tech. It is very simple technique. You won't cause them harm, right? And they will start feeling better. They will literally bless you.
Okay. So there was one more questions. Then when the neck mobilization was done and the technique was applied by belt, Mulligal belt or by the manually, so that improvement in the neck movement, the range of motion in context of range of motion, was that a temporary or was it wasn't a permanent?
No. It will be permanent means if the exercise is done, if the patient starts continuing doing the homework, doing the exercises, what we show and lying down in that position, it will definitely almost 80% will remain. There was a question on contraindication for not to do. If you doubt that the patient has cox spine, TB,
Okay.
tuberculosis. So we
Yes,
don't
yes.
want to irritate that tuberculosis spot which is near the spine. Right?
Yes.
And osteophytes. If the patient has a lot of osteophytes, right? So we can mobilize, but you have to be cautious in mobilizing.
Yeah, because the pot spine, if the pot gets ruptured, then the sputum will, the rupture will come out.
Sorry,
The pus formation will
I'm
come
still
out.
on the call. I'll call you back. Pardon?
Yes, sir. Once the if the patient is having a pot spine and if the pots get ruptured, then lot of pus will come out of that, and there will be a
Right.
paravertebral shadow over the
Right.
spine, and then there will be a
So
further problem.
see, if the
So
patient is young, you can see the mobilization. The initial results are the expression on the face. If it is painful, you have to be careful to take an X-ray. If the patient comes with an X-ray, you can do it. So as you see number of cases, you will know that you are doing good.
okay, yeah, definitely, sir. And sir, there was one more question that in PIVD, is it good that we should mobilize the patient or we should not ask the patient to move at all? Which one is good at what time?
Come again,
Sir, in the case of PIVV,
PID.
if the so in that case, if the disc has
I
been
mobilize
collapsed,
it. I mobilize.
okay, so what are the reasons for that, sir? What are the point that we are keeping in
Because I
mind?
mobilize to an extent that I put the disc back. So in extension and rotation, you put the disc back. Even if the disc goes back by 10%, the pain goes away.
Okay,
It again
so
depends on patient and how you are managing that patient.
okay, So the one who has asked this question, let me make the thing simple. Sir is telling in such a way that the sir prefers to mobilize, but taking into the mind that the technique should be very much perfect, that the symptom should not get worse and the dish should get back into the position. So if you are confident enough, if you are having a good skill power, if you have a good manual techniques, and you have 100% confident on yourself that yes, I'm the right person to put the dish back into the right position, then you must go for it. Am I right, sir?
Yes, I believe that when you start working on a patient, you know how much pain is a signal that something is wrong somewhere. Like thirst is a signal that the body requires fluid, right? And sorry, giving traction to lumbar area or cervical area is again, you are opening up the facet to traction, but lumbar usually doesn't happen. We have other traction machine where your body weight is used. I'll be showing it next time, that machine, how we use the body weight. Otherwise, cervical traction she has shown you with hand, but how much it can do, nobody has done a study whether you can do the lumbar traction. Whether traction is, this is what we want the vertebrae to open up. So the facet opens up and the pinch of the nerve goes away. So till it's difficult to any study to show that the spine really gets the traction. It's very heavy down there. So, and there are abdominal and the muscle which are there, whether that will allow to really give you lumbar traction. Usually in lumbar traction, they put you on bedside for 2 to 3 weeks. So the bed rest only takes care of it, not the traction. And marble, somebody asked about the marble. And the marble, yes, of course, the sportsmen do it every day then. You can do it every day till you feel your hamstring is released. A time comes and you don't need. You are touching your toes very comfortably.
Okay.
Thank
And
you,
sir,
Bhumika.
yes.
Bhumika, thanks. I got your message.
Yes, and then there was one more question, sir, that if you said that in the prolapse interval days you are going for the treatment, so then what is the exact condition which is contraindication for the manipulation, even in the disc
See, today
prolapse?
whatever I showed was mobilization. So in mobilization, you don't have to worry. There's no more, except you know that it's a cox spine or a TB spine. Osteophytes. If the X-ray shows a lot of osteophytes, I'll go slow, but I'll still do. I have to mobilize it. I'll still go. And as the day increases and the patient is feeling better, I feel your confidence increases in mobilization. It's important to mobilize. Just lying down prone, it's going to help in corona cases because of the lung lobes. Lung never has to be in standing position, in vertical position or horizontal. And you put the patient in prone. We have been started pushing the patient, all corona positive cases, in prone. It helps them. So it's a type of mobilization. We have to mobilize the patient.
Yes, yes, I got your point, got your point. And sir, the one more tradition that has come up, the one of the students has asked that nowadays the people are sleeping over the floor without mat, without the pillow. So what exactly it is? Can you enlighten what that they are trying to go for an extension kind of certain things?
I don't. A normal cotton mattress is great. It's this, a normal. See, it should
Yes.
not push down. So when you push your hand, it should not go down much. But I don't want the spring ones are bad. The extra foam is bad. You should not drop. You should not, get drowned into a mattress. Otherwise, the mattress cotton is very good. And pillow, I feel when you're lying on your side, this your neck, from your neck to your shoulder has to be covered up. So you can't lie like this whole night. So there has to be a pillow to cover to fill this distance. That's why we take our hand under the pillow, or directly we sleep on a hand like that, because this has to get filled up.
Yes. Got your point, sir. And sir, there was one more question from the audience participant. They are asking, sir, the technique which you showed regarding the marble, that putting under the foot and then increasing, they are stretching, stimulating the fascia, and hence the length of the muscle is getting increased, the range of motion is getting increased. So in that context, sir, the question is, do we need to do on a regular basis? And even if the patient is coming to the department, should we?
If next day it is, but next day also will be better. It won't get to what, there's always an increase gradually. A time will come you won't need then. But players
Correct.
usually do it. Then there's a bigger marble, there's a smaller marble. I've got all size of marbles. I have a whole dabba of marbles. So seeing the valgus, I decide which marble to use.
Okay. And sir, the associated question along with that, in that context, the old traditional fashion that we are following, hamstring stretching. Should we go along with this technique?
No, you have automatically stretched now. You don't have, I said I should waste 10 to 15 minutes to stretch a hamstring of a player. After I
Yes.
have given them marble, my problem is solved. I don't need to.
Okay.
No medial wedge instead of marble. A marble goes specifically to that fascia. Wedging does not stimulate the fascia. So no more shortcut. That fascia needs to be stimulated. I should take back of a pencil and stimulate that pod for 2 minutes. Now I brought it to stand on marble, so you want to still put it into the shoes. So the wedging was there earlier also, but the wedging was not showing any result.
Okay.
Next.
Yes, sir. There is one more question, sir. Can cervical mobilization cause vertigo during the supine position?
Yes. People, those who have vertigo and a lot of osteophytes, they have. So you need to handle it properly. So the handling of it, it will make it better if you mobilize. Mobilize will help. But if suddenly you have taken the patient in extension or suddenly taken the patient in flexion, it does, you have to manage it nicely.
Okay, sir. I hope the viewers got the answer. Now, the another question is there, sir. In the case of spondylosis, and it was already operated, sir, or it was already treated by an operation, then after that post-operative, how much time we can give for a spinal mobilization?
If the H-rodding was done, that means it had taken place. H-rodding was done, so that means it has been stabilized. You can still mobilize.
Okay, got it, sir. And sir, one more question is there. Can this marble technique improve pace planus?
Pardon?
Can this marble technique improve pace planus, sir?
One second. This patient now. Talk to my staff. Get him on the video.
Hello.
No, I'm here. Sorry.
Pace planus.
Can
marble helpful in pace planus treatment, sir?
to mobilize the fascia? Yes.
Okay. Yes. Okay, sir.
You can use marble in many other. I've used that for hamstring muscle. There are so many other. Our full body is full of fascia. Above every muscle there's a fascia. So depending, I said we are still working on it. Other places where we may keep it may help some other problem. I'm planning for trapezitis. I'm trying to get the mobilization through it, mobilization of neck through, not exactly marble. Maybe I will place a tennis ball. So I've got a series of ball kept here. It's only for studying, where we don't know what will help where. Our students are doing it.
Okay. Got you, sir. And sir, can manual traction helps in improving disc compression?
Yes. Manual traction is much better. Lumbar, it's difficult because lumbar width is another technique which I have to talk along on the lumbar. Cervical, yes.
Okay, sir. And in comparison to mobilization and manipulation, sir, which one is better for pain relief?
Manipulation. But unless you have not done mobilization for 1 year, you should not enter manipulation.
That's the basic stuff that we need to learn.
The trick is there.
Trick is there. First, on hands-on, we should have a good technique.
Mobilize. It's a little more degree, it becomes manipulation. So it's that simple. So mobilize, a little more is manipulation.
Yes. So that
So
is an
how much
advanced.
that little has to be there is what we have to learn with practice.
Correct, sir. Correct, sir. So, participants and viewers, do you have any further questions? Yes, please.
We'll have to go. We'll take this as the last question.
Last question.
This is
Since
last
you are
because
here.
I've got many people just, my other phone is non-stop ringing.
Yes, sir. We can understand that. I think, sir, students are happy,
Thank you.
and yeah.
Thank-
So
Just one line to them. I always say, please understand, you have joined a healing profession. Putting a smile on your patient's face. Any patient that blesses you, your life will change. I can only pray that may God give you a healing hand. All of you all should have a healing hand. That is more important.
correct.
Thank you very much, sir, being with us. Mind blowing, very live, very live. So I am 100% sure all attendees can benefited. 100% sure. Successful session. Okay. Thank you very much, sir.
God bless.
Thank you.
God bless you all. Thank you. All the best. Thank you, Mehul.
Thank you, sir. Thank you
Dr.
so
Mehul,
much.
nice knowing you and all the best. Hope to
Thank
come there
you,
very
sir.
soon. Bye-bye.
So definitely, once the lockdown gets open, we'll have you on campus.
Because I come up to Sanjan, so it's hardly any way from there.
Sure, sir.
Yes.
We are waiting
Yes.
for you.
We will. I'll come. God bless you all. Take care.
Thank you,
Thank
sir. Thank you so much.
And Janvi, thank you. Bhumika, thanks.
Yeah.
Bye-bye.
Okay,
Bye.
sir. Yeah. Bye, sir. Bye.